Every survivor has a story. Some stories inspire, not so much for the battle they wage, because every cancer patient fights, but for what they do with their lives afterwards, after the treatment has ended. I think you know the ones I mean. Personally, I was never going to be in the Tour de France, but I do have my own personal little set of miracles. Like some of you, I am a cancer survivor. I am a 25-year survivor of metastatic Ewing sarcoma, a pediatric bone cancer. My story begins, thank you. Wasn't quite prepared for that. My story begins in 1981 when I was 15. Mine was a story of pain. For 9 months prior to being diagnosed, my right leg was in a state of progressive, sometimes excruciating pain, which was explained away by the doctors as growing pains, or maybe it was just my imagination. Except in my case, as the bone was pulled apart by the tumor, the pain was so severe that I was unable to sleep at all for days at a time, and at the end, I'd be awake for an entire week. Because of those 9 months of private battle, I reacted to hearing that I had cancer as I did. I laughed and went back to sleep. For many, the diagnosis is a surprise. For me, it was truly a relief. Whatever the odds, I was no longer dealing with a faceless enemy. Of course, there was a split second, why me? But as many of you know, this was immediately answered, why not me? No one is immune. That said, I do think about why I lived when so many others didn't. In my case, I was the sole survivor out of a group of 10 children with Ewings that were being treated at the time. I didn't fight any harder than they did. My family didn't love me any more than theirs. Our treatments were equally aggressive. Long ago, I came to the conclusion, maybe I was just lucky. As lucky to survive as I was unlucky to get cancer in the first place. Lucky the tumors responded to chemotherapy, and maybe lucky that in my first week of treatment, a really irreverent nurse told me, all the kids I know who live gain weight. Besides, if you don't, I'll break your arm. So during the next 10 months, I gained 50 pounds. By the end of my treatment, my tumor was receiving about 50% more drugs than when I started. I can't imagine that didn't help. When the tumor was removed, there were no Ewing's cells left alive. Ironically, it was right about then when I really felt fear. I hadn't feared the chemo, the radiation, or even the surgery. As many of you know, those are just the costs of getting to remission. For me, the day I really felt fear was the last day of treatment. After that day, there are no more plans. That day, I was on my own again. That day is the day I believe I became a survivor. What then? What would keep the cancer from relapsing? What damage had the chemo done to my lungs, my heart, my liver? Would I walk? Would anyone love me? Would I have children? These were the issues of survivorship for me, which brings me back to my four little miracles, actually. I survived. I didn't relapse. Miracle 1. My titanium implant was meant to last 2 to 7 years. It's been 25. That's miracle 2. Barely 5 years after my last treatment, I introduced myself to an amazing woman with the words, "Hi, I'm Nicholas. I had cancer when I was 15. We're married and have been together for 20 years. Miracle 3. Finally, despite learning at age 21 that probably due to the chemotherapy I received, I would never have children, through recent advances in vitro fertilization, we were blessed with a healthy daughter in 2002. She's now 5 years old. Icing on the cake. Miracle 4. Clearly, for me, cancer is part of my DNA. It's a profound and fundamental part of who I am. But it's important to live beyond cancer, its limitations and the limitations caused by the treatments we received. We owe it to those who weren't lucky enough to survive. Thank you for listening to my story.